Hi, my name is Ravi Vij. I'm from My Cancer Haven, and today in the Conversation with Cancer Experts series, I have the fortune of having Dr. Samir Parekh with me. He is director of the Center of Excellence for Multiple Myeloma at one of the most established myeloma programs in the country at Icahn School of Medicine, Mount Sinai, and he's one of those rare, physician scientists who can bring a perspective not only into the clinical realm, but also into biology. So we're going to talk today about targeting protein degradation pathways in myeloma. Welcome, Samir.
Thank you, Ravi, and thank you for the kind invitation to speak on this exciting topic. We use targeted protein degradation by various IMiD molecules, uh, and this has been the mainstay for myeloma treatment for many, many decades. But before we get into that, I think it would be amiss if we didn't talk about actually how the drugs came about
Oh,
and
yeah,
how
that
they
is.
were used initially. They were actually meant for pregnant women with nausea, and indeed caused, unfortunately, a lot of babies with fetal abnormalities in Europe, and the drug was actually withdrawn in 1961, as you show here. Um, Thalidomide was continued as a treatment for leprosy, and people continued researching it in the lab for its anti-angiogenic effect. And around the 90s, due to a patient who was treated in Arkansas with relapsed myeloma, and in fact, it also gives the importance of family in the treatment of patients with myeloma because it was the patient's wife who persisted and found a recommendation from a eminent scientist at Yale to give this drug, and then the Arkansas team gave the drug, and the rest was history because the patient did indeed go into remission, and then thalidomide was approved for the treatment of myeloma, and it has now given way to a whole series of second, third, fourth generation compounds, each one being more effective than the other. And as you can see here, they are not just being used in multiple myeloma.